Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance health and well-being in day-to-day life. My name is Dr. Wafaa Faysal and I am a consultant pediatrician in Dubai. And my guest for today is Mrs. Claudine Gillard. Mrs. Claudine Gillard is a sleep consultant for children from newborns to all ages, and she's the founder of Sweet Dream Consulting. Welcome, Claudine, to Medcast.
Thank you, Wafaa. It's lovely to be here. Thanks for asking.
It's lovely to have you, really. So this topic is very, very interesting and it's very dear to my heart, actually. And I think it will be interesting to our audience, the listeners to this podcast, because as a pediatrician, we know the importance of sleep to children in general. Sleep, if I can say, is important for the children's physical health because the growth hormones and the hormones responsible for their growth are secreted during their sleep times. Sleep is important for their emotional well-being. It's very obvious that when a child doesn't sleep, he spends the whole day not in good mood. He cannot control his emotions. Sleep is also important for their learning because by evidence, we know from studies that children who don't receive the proper amount of the sleep for their age will not learn and will be very forgetful, and their ability to learning goes down. Sleep is also important for the immune system. So for the children to stay healthy and not to attract germs and diseases and viruses, especially those going to the nurseries, the schools. Sleep is also important for the appetite. So it can prevent obesity, and even picky eaters can be helped if they have proper sleep. And what else? A lot of things, I think, also...
it's everything.
It's everything. It's everything.
Every aspect of our well-being is improved by a good night's sleep. There's no downside to sleeping better. No one can be worse off from a good night's sleep.
Exactly. And not only for children, now sleep is proving that it's very important for adults, adolescents, of course, and adults. Adults also who want to stay young and into longevity and anti-aging like me. Yes. And sleep is proving one of the number one tips for or tools for anti-aging.
Yes.
Because they said the aging genes, they are switched off during our sleep time.
Yes.
So as you mentioned, Claudine, who doesn't want a great night's sleep?
Of course, exactly.
Yes.
And I'm so privileged to be part of a journey with the families and adults that I work with to make that happen. So
yes, because your role is vital.
Thank you.
In the individual's life and in the family's life, and I think it will reflect to the whole society.
100%, yeah, exactly. I was talking to somebody this last Friday, and he was telling me about his poor sleep habits, and I said, but it was as a result of his child's sleep. And I said, so is it your sleep that's a problem or your child's sleep? And it's evidenced. The parents aren't sleeping well because of the child. So the parents are affected, the child's affected. If the child was sleeping well, the parents would be sleeping well. So everybody can benefit.
Exactly. So being a pediatrician, we receive the children as a newborns. We receive them for the first visit with their parents, and the parents, of course, after the delivery or the cesarean section the mother underwent, they have a lot of questions, and of course they are let's say tired, fatigued. They have been stressed through this process, and they start complaining that they are not sleeping at all. So as pediatricians, we were mentioning before that we are not sleep consultants. We know how important sleep is, but how to advise them fully through the process. We can give them some tips, some advices, but in reality, we are not with them at home. So as a sleep consultant, I think you have a big role. Do pediatricians refer to you patients as should be in our region?
Absolutely, yes. I mean, I have quite a lot of doctors in Dubai and Abu Dhabi who refer their patients to me. It sort of proves to me that it falls outside of a doctor's remit, the actual change that the parents can or should make to improve their child's sleep. Their job is to obviously see the patient and identify that there's not enough sleep happening. Yes. But they don't have the expertise all the time often to really delve into that with the family and make those changes and help them to make those changes. So that's where I come in.
Yes.
And so it's really, I'm very grateful, but I'm very glad that doctors are aware that there are services like mine out there that families can benefit from.
Yeah, exactly. Because doctors should know that
Yes.
there are sleep services for the patients to refer them and to give them the proper information and guidance in this process. However, I think a prenatal visit for a sleep consultant is also encouraged because they should know what they are expecting before even the baby arrives, in my opinion.
100%.
Yeah, now we are encouraging is a visit for the pediatrician before the baby is born, and with the sleep consultant will be also very important.
Exactly,
Yes,
yeah.
very much needed.
I mean, I think when people have a baby, they expect to need to learn or know how to change the baby, how to feed the baby, how to care for the baby. But I don't necessarily think everybody focuses in on sleep. I think we all expect that when we have a newborn, we're going to have some nighttime wake-ups and some night times that we need to attend to our child overnight, which of course we will need to do. No one expects a newborn baby to sleep with an unbroken night. But it's also important to recognise age-appropriate sleep needs. And very often what happens is that parents either aren't aware or they are aware, but they're struggling with how to make a difference, how to make a change.
Yes.
And despite the fact that they're waking up and attending to their child, the child's still not sleeping enough, unfortunately.
Yes, very true. This brings me to this coming question. So we know that newborns have to wake up in the night, especially in the first month, because every 3 hours the baby needs to feed. So this is usually I think the parents take it as it is and accept it, and of course they have many sleepless nights, and it's a time where like they need support from family and mothers, etc., parents. Yes. However, coming to the coming months, like maybe from the second month, third month, fourth month, if the condition stayed as it is, like the baby is not sleeping in the right time, waking up also more frequent, maybe every 2 hours. Some babies wake up every 1 hour.
Yes.
Although I tell them as a pediatrician, like from the after the first month finishes, the baby can stay 4 hours, 5 hours without even drinking milk. If he's sleeping, the baby is sleeping. Keep the baby sleeping and get some sleep yourself. So, as a sleep consultant, when does your role start? At what age of the newborn baby your role starts? You can intervene.
Yeah, it's really interesting. So there are people who do reach out to me before the baby's born, and I used to do a lot of workshops for prenatal classes. But like you said, in the first month, I think everyone's just finding their way with their new child, getting used to being a parent if they haven't had a baby already, or navigating a new addition to the family. However, anybody can reach out to me anytime. It's never too early to start making progress towards good habits. I don't want to be using language like bad habits, but eventually, if you have a habit in place that you're not welcoming later down the line, then you might consider it to be a bad habit. So definitely in the first month of life, there's still measures that can be put into place to ensure you're setting yourself up for success. But certainly, as you say, by the end of month 2, if a family has hired me when they've got a newborn, I normally find those children are sleeping through the night, or certainly on one feed a night. Yes. And my point to families always is not that we don't meet the needs of the child, it's not that we don't not feed a hungry baby, but we just recognise that if your baby is asleep, they're not hungry, and so better off to have longer stretch of sleep, 1 feed or maybe 2 maximum, and consolidate the daytime feeds and consolidate the daytime sleep, then as you said, multiple wakings at night that really aren't hunger based, they're just habit or unfortunate situation that you found yourself in. And then what you end up with is cluster feeding, gas, colic, poor daytime sleep, unsettled child, unhappy parents. So no time is too soon, but definitely after the first 4 weeks, you can certainly make huge improvements from what you have with the newborn.
So I understand that the early intervention is always encouraged because we set the rules and the foundation, if I can say, to the good habits for establishing the sleep we want for this baby and for the whole family. Because if the baby is awake, everyone is awake.
Absolutely.
So coming to, let's say, the second part of the infancy, or the second part of the second 6 months of life. Here we expect really the baby to sleep through the night, and if there is going to be he's going to be hungry, he can wake up one time probably to feed, and that's it. But many are waking up every 1 or 2 hours. Many want to. From my patients, I'm telling you these complaints. They complain that the infant wakes up, for example, 8-9 months. in the middle of the night, he wants to play. And they don't want to sleep again. And sometimes just getting the bottle, throwing it away, they don't want to feed, but they want to wake up. So I ask about the naps during the day. I ask about the feeding during the day. So what tips sleep consultants use? And do you sometimes go to the houses to have hands-on, probably?
Yes. Answering that last question first, absolutely, yes. I'm more than happy to visit my clients, come to them at home, support them directly, give my advice live. I'm more than happy to do that, and I welcome it, to be honest, because I think by me being there, it empowers the parents, it gives them confidence, it gives them reassurance. It helps to provide a calm environment and atmosphere, because that's really important. We're talking about regulation and behaviour, and children regulate through their parents' behaviour. So, yeah, I think me being there is often very valuable.
It is.
But turning to the first question, essentially what I find is in place with every single family I work with is that the child has a dependency in some way on the adult caregiver, whether it's the parents or an employed caregiver, whereby that child does not expect to fall asleep alone in whatever way might be happening. I have people who are bouncing their child up and down on a yoga ball, which was the lady I spoke to yesterday. She's got an 11-month-old child. She's telling me how heavy he is, and she's still bouncing him on a yoga ball that she was doing when he was a newborn. So that's an example. Rocking in arms, feeding to sleep, pacifier, walking around the room, driving in a car,
Strollers,
in a stroller.
yes.
And whatever that setup or whatever that journey to sleep looks like for that child is going to expect that when they wake up at night. Now, it's perfectly normal and natural for any human being to wake up overnight. I wake up at night, I turn position, I go back to sleep. No one's settling me. Okay, it's the same for you, Wafaa, you're an adult. It's the same for children who have either been sleep trained or have grown out of it. But for children who are in somebody's arms when they fall asleep, they're going to wake up and think, I'm not in their arms anymore. And I wasn't in this place that I am in now when I fell asleep. So what do? I don't know what to do. And I need that person to help me again. So then the mother or the father or the caregiver has to go in and resettle the child. Well, then what you have is, oh, here comes mummy, the best thing in my life. I might as well stay awake for a couple of hours and hang out with my mum. Because children can't tell the time. They don't know what time it is. They don't know they should be asleep. And if they get a visit from somebody they love, in their mind, that's a treat. So they will stay awake for 1, 2, 3 hours, 4 hours. I have a family at the moment who contacted me. Their daughter wakes up at midnight and wants to stay awake till 6 a.m.
Yes.
And this is 2 working parents.
Yes.
So things can get really desperate,
Yes.
and things can get very difficult. And the reality of life is that child should be asleep. Yes. You know, there's no benefit to that child to be playing with mummy at 2 a.m.
Exactly.
Okay? There is no positive outcome from that.
Yes.
I know it feels like, oh, what do I
Cute.
do? What else do I do? Yeah, well, it's cute. I mean, look, aren't we lucky? Our little
Yes.
person who loves us most is looking at us smiling. Of course, it's lovely. But the flip of that is, as you said, the daytimes can be difficult. You've got a child who obviously is not as well rested as they should be. It can impact appetite, as you say. So there's lots of repercussions to just reacting and just responding. Exactly. And so when I talk to people, I say, you're dealing with the right now. You're not solving any problem. You're dealing with what's right in front of you right now. Whereas what I would advise you to do is look to make a change so that the right now that you're dealing with goes away and ends up with you all sleeping well. And, you know, any baby of 6 months or above can sleep through the night. And we're talking 11 to 12 hours of unbroken sleep.
Amazing. And I will tell you from experience also that the most miserable parents who come to me are those whose babies don't sleep.
Same
So,
for me.
yes, really, they are among those even who have some of them can get sick and like that. But I see the faces, the most miserable, most tired, who they are really desperate. They say we don't have any nighttime sleep because of him, and they have work and they have their
Have a
work
life
efficiency
together.
and functionality all is affected. Yes. So, but what we know from sleep training, like from the old days, and what we get is a perception, and I think many people have this perception. Of course, I changed it after I knew a bit more, but I want the people to change also this perception, because we think that sleep consultants will tell us, leave the baby to cry. Give him something, a teddy bear or something, and leave him to cry. So this is what people think sleep consulting is. But it's not this. There are now techniques and modern ways and different things.
Exactly.
I leave you to go comment on this.
Exactly. I mean, I think if I was to say the biggest single question that everybody asks me, and I think the biggest single obstacle every parent has, myself included. Before I knew this, because I was a sleep-deprived parent, I hired a sleep consultant when my son was 2.5. She changed my life, and I became a sleep consultant as a result of that experience. So I've definitely been in the position that my families that I work with are in. I know the situation very well, personally and professionally. And I think everybody has this concern about crying. And of course, as a parent who loves their child, you would be concerned. Why is my child crying? What is it that I should do about that? You know, it feels like it's a reactive or a reaction that we need to address. The reality of life is children will cry. They will cry whether you sleep train them or if you don't. You know, you're a mother, you know that sometimes your child will cry and there's not always something you can do about it. It's not always your job to resolve that for them, depending on what the reason for the crying is. But crying is pure communication. So my role is to help the parents to understand the need they are communicating and respond appropriately while still moving forward towards this goal of better sleep.
Yes.
So if the need in the moment is feeding, no child can feed themselves, you know, when they're so young, that the age group we're talking about. So of course, child needs to be fed. If they've got a dirty or wet diaper, of course their diaper needs to be changed. If they've got a pain, of course that pain needs to be comforted or dealt with. But if the child's communication in this moment is, I am tired, then our role is to provide them with still reassurance, support, consolation, comfort, but maintaining our objective of them sleeping well. Because if they are able to sleep by themselves, then they won't be tired, but they'll also be able to put themselves back to sleep. So crying is just one way for a child to let us know that there's something going on. And our role is to make sure that we respond appropriately with that. With our reaction, yes, so that we are still making sure we get to the point that we want to get to.
So it's not only an emotional reaction from parents. It doesn't help. And I think this helps also build character in this child from this early age. So to be able to take responsibility or something really about his...
So many families come to me and say, I can't leave the room without my child crying. My child doesn't want to play on their own. They're very clingy. They're very needy. It's all about me. And I say, well, they're hyper dependent on you because they're dependent on you during the day, completely fine and normal and appropriate. They're dependent on you all through the night. What I see with my families is as soon as a child becomes more independent for their sleep, in a really healthy, supported, loving environment, but as soon as they become independent for their sleep, they realise that there are things that they can do for themselves that are age appropriate, and there are times that they need their mother or their father, but that's not 100% of the time necessarily. So, and another example which you mentioned about development. So I had a family I started working with on Tuesday, and their little boy's 5 months old, and he's had 3 good nights of sleep, and he started rolling literally today. Yes. And now he wasn't even attempting to roll because he was so exhausted.
Exactly.
So in really literally a few days of making a change to how well he's sleeping, because this little boy was waking every hour, he's now able, because he's well rested, to use this new to embrace this new skill, which is obviously a skill all children need to learn.
Yes.
So yeah, it's wonderful the improvements that can be made in such a short amount of time.
Yes, that's brilliant. So Claudine, I will ask you a bit about the time we are living in right now, the screen times, and that all the children are on these devices and the iPads, the phones, receiving all these stimulations. Their brains is receiving all the stimulations. So it makes it really difficult, not only for infants and let's say toddlers and preschoolers to sleep, also for school-age children. We are struggling with them to sleep. Even adolescents, I'm struggling with my children to sleep. So what advice you can give us as parents? All the children are suffering, even the adults.
I know. Well, I was going to say...
the stimulation, from the electronics.
Exactly. Adults as well, as you say. So the blue light that is emitted from a screen is a suppressant to melatonin. And melatonin is a hormone that's secreted in the brain that supports us to fall asleep. So it doesn't mean that we can't sleep without melatonin, but it's really helpful. And therefore, if the screen is happening too close to sleep time, it's meaning that the melatonin is not being produced. So I always say to parents and adults, at least 1 hour before bed, ideally 2, you don't have any influence from white or blue light. Blue light comes from the screen, white light comes from ceiling lights. So if you avoid that, your child will fall asleep more quickly.
Yes. In addition to the normal routines that everyone knows, this will help for sure. Any role for medications? Because we are doctors, we sometimes prescribe some homeopathic medications that to help. But I think it's a behavioral really issue. So solving it without medicine is the optimal solution.
For me, it's always behavioural, because if it wasn't, I'd be referring to a doctor. I mean, there are things like Epsom salt baths that's good for children because it's relaxation, and that's got magnesium in it, which we know supports healthy sleep. There are people who don't produce melatonin, or certainly don't produce it as much, where melatonin supplements are needed. But melatonin should only be used if prescribed by a doctor. Over-the-counter melatonin is not recommended.
Yes. Any success story you want to share it with us? Like, I know there are many but
yeah.
Like one thing that can come to your mind at the moment.
Yes, I mean, I had a family reach out to me. So I work with a lot of twins, and obviously twins are double the joy and double the difficulties at times. So I always love working with twins. I find it very, very rewarding. Obviously twin parents, often they're IVF babies, so it's been a big journey to bring those children into the world. So yeah, it's always my pleasure to work with twins, and many twins love sleeping next to each other. Of course, you never separate twins unless the parents want that. But yeah, it's my pleasure to always work with twins.
Yes, you're doing a great job, actually. Really, sleep is very important for every human being, as we mentioned, for children even more and more. And you are available in Dubai and Abu Dhabi, this Sweet Dreams Consulting. You are giving it you can give the services to Dubai and to Abu Dhabi.
Absolutely,
yes.
And anywhere else in the Emirates. But yes, we are predominantly focused in Abu Dhabi and Dubai.
Yes, your role is really very important.
Thank you,
and very well done for all what you are doing. And thank you for being with us.
My pleasure. Thanks for asking me.
Thank you.
Thank you.